right, here I am. This is round 2 of my chemotherapy regimen. It's called AC, adriamycin and Cytoxan. And yes, adriamycin is the one they call the Red Death, and it actually is red as it's going into you. They handed me this as I walked in. No one fights alone. I really liked that. But of course, I've heard from so many of you, you've kind of shown me that nobody fights alone. And this one, once again, has a side effect of nausea. However, these days there are all kinds of other medications that they give you. They've already given me some of them that fight that. So you really don't have to expect to feel really, really crummy like in the old days. As you're going through this, a lot of people stay right on the job. Some don't even tell other people that they're going through this. But I frankly think that you shouldn't try to just go it alone, because support from family and friends is really important. It is highly recommended with this round just because it is so toxic that you have a port. And of course I have mine. I've talked about this before. But when you try to have it go into your arms, into the veins in your arms, it can literally kind of blow out those veins, and people get very hardened veins. So they recommend that you have a port, which is not a hard thing to do. It was like an hour in the hospital outpatient. And that's where I get all the drugs through. And it actually goes through like a little, you can almost see it here, like a little tiny tube that actually goes right down into one of my veins, which puts it through my heart, which disperses it throughout my body. So it's much more efficiently delivered to the body. And I will take this treatment every 2 weeks for 4 treatments. And I'll take you along on this journey.